So here we're going to be looking at some of the arteries and nerves of the abdominal cavity. We see our descending abdominal aorta here, and it's going to give rise to this very large artery, which is the external iliac artery. The first branch coming off of the external iliac is this artery here that's going towards the abdominal muscles, and that's going to be the deep circumflex iliac artery. The deep circumflex iliac artery then has two branches, one that's going to be running cranially along the internal abdominal oblique muscle. That's going to be the cranial branch. And one that's actually running ventrally. It's kind of in this fat is a little bit in the way here, but if you see an artery running ventrally along the internal abdominal oblique, that would be the caudal branch of the deep circumflex iliac. The deep circumflex iliac, the external iliac then continues distally, and it's going to terminate as this very large branch and this kind of smaller branch. This one, as you see, is staying on the inside of the abdominal cavity, so that is the deep femoral artery. The deep femoral artery then terminates as the pudendo-epigastric trunk and the medial circumflex femoral artery. The pudendo-epigastric trunk then gives rise to this artery that's traveling along the lateral aspect of the rectus abdominis muscle. That's going to be the caudal epigastric. And this artery is moving through the inguinal canal to come out externally here at the mammary gland of this female. So this is going to be that external pudendal artery. The external pudendal artery, again, just like it was in that other mammary gland, is going to give rise to the cranial mammary artery and the caudal mammary artery. If these are not clear, please make sure to watch the mammary gland video. So coming back internally, again, just to reorient, we have the deep femoral artery. And the other very large artery that's coming off right next to it is going to be this artery right here, which is the femoral artery. The femoral artery, usually right around in this vicinity, is going to give off another very large, or pretty substantially large artery, and it's going laterally over towards the quadriceps femoris muscle. That's going to be your lateral circumflex femoral artery. We're going to jump over to the other side or the other limb. And just to help orient yourself at this point, we're seeing the split of the deep femoral artery and the femoral artery here. If we pull this, we can now again see that lateral circumflex femoral artery coming off laterally from the femoral artery. The femoral artery then continues distally through the medial side of the thigh and is going to give rise to this artery, which is staying fairly superficial along the medial aspect of the crus. That's going to be the saphenous artery. The saphenous leaves the femoral, and the femoral artery continues to traverse distally. And somewhere down here, right towards the area of the stifle, is going to give off an artery that descends down to the stifle. That's going to be the descending genicular artery. The femoral then kind of dives deeper. And so what we've had to do is reflect the gracilis muscle and reflect the semimembranosus muscle. Might have to pause. Well, there we go. And it's back here on kind of the caudal aspect of the stifle that we see a very large artery coming off. This artery that we see right here is the caudal femoral artery. After the caudal femoral artery comes off, the femoral transitions into the popliteal artery. So the popliteal artery is this artery that's diving kind of in between those medial and lateral heads of the gastrocnemius. The popliteal artery kind of wraps around the lateral aspect of the limb and will then come out underneath these cranial tibial muscles here as the cranial tibial artery, which we see right here. So that's the cranial tibial artery lying right on the cranial aspect of the tibia bone. It continues distally over the tarsus and will at that point become the dorsal pedal artery. If we get down here and look, we can see it kind of in between all these tendons down here. It's this artery right here that's traveling over the dorsal aspect of the tarsus. The dorsal pedal then continues distally along the metatarsus as dorsal metatarsal artery 3. It's going to be traveling right through that dorsal longitudinal groove where metatarsal bone 3 and 4 fuse. Now, what we're going to look at, we're going to transition back to the original limb, and we're going to look at some of the nerves that are going to be present within this area. So here, to reorient, we have our external iliac artery, and then we start to see some of these nerves coming out right here. This very large nerve that's running down here towards our obturator foramen will be our obturator nerve. And then if I reflect some of these other vessels in the female reproductive tract, we see this very shiny structure. That's going to be the sacrosciatic ligament. Most of the nerves within the lumbosacral plexus, specifically the sacral plexus, are going to be found kind of within or running through this sacrosciatic ligament. However, we can see some of the nerves that are back here a little more caudally. We see this nerve right here that's arising from the sacral plexus and traveling down towards the area of where the lesser ischiatic foramen is. That's going to be the pudendal nerve. We see this nerve right here that's arising very, very close from where the pudendal nerve does, but we see that he's running over here towards the lateral aspect of the rectum. That's going to be the pelvic nerve that comes over here and is going to join with this nerve, which is the hypogastric nerve, in order to form the pelvic plexus. So as a review, the hypogastric nerves come from the caudal mesenteric ganglion, travel caudally, and kind of meet up with the pelvic nerve to form that network of nerves known as the pelvic plexus. We'll look at some of the other nerves when we transition to the horse. To finish up the story of the vasculature at this point, we're going to have to turn to the internal iliac artery of the bovine. So let's reorient again. We have our external iliac artery, and now we can see our internal iliac artery. And in the bovine, the branching is pretty substantially different from the equine, with the difference being that most of the branches that are coming from the internal pudendal and caudal gluteal in the equine are actually coming from the internal iliac in the bovine. So what I mean by that is, again, we see the internal iliac here. The first branch of the internal iliac is actually going to be that umbilical artery, which we see now is patent coming down here towards the bladder. And so that's going to be the round ligament of the bladder. But we do have that uterine artery coming right off. As we travel caudally, the internal iliac is then also going to give off an artery going kind of cranioventrally here. That's going to be the iliolumbar artery. And then we have these arteries, which there's two of them here, but they're all going to the same place. So you would actually classify this whole branch you see right here as the cranial gluteal artery. So in this cadaver, we actually see the iliolumbar is coming off of the cranial gluteal, whereas in many of the other cadavers, it comes off directly from the internal iliac. The internal iliac then continues to travel caudally, and it's back here that we see a pretty far caudal branch coming off. That's going to be the vaginal artery that's coming directly over here to the area of the vagina. So again, this is the vaginal artery that gives rise to this branch that's coming along, or going to be coming along the uterus. That is the uterine branch of the vaginal artery. And then the vaginal, or after the vaginal comes off, we see that that internal iliac is still traveling caudally. And finally, back here at this lesser ischiatic foramen, it terminates as the internal pudendal artery and the caudal gluteal artery. And all of these branches that you see coming off, going laterally through the lesser ischiatic foramen, would all be from the caudal gluteal artery. The internal pudendal then continues to wrap around here and is going to give rise to the artery of the clitoris in the female. The one branch that I did neglect to mention is another branch that we see right here coming from the vaginal artery. This branch, and what I'm going to do is I'm going to flip this tract over a little bit and have us look down kind of along the dorsal aspect of the vagina right here. So to reorient, we have our internal iliac giving off our vaginal artery. And the first branch off this vaginal artery here is the dorsal perineal artery. The dorsal perineal is actually what's going to give rise to the caudal rectal artery going towards the external anal sphincter and a dorsal labial branch. Since we're in this region, the only other things to really look at here are going to be this muscle, which is the intrapelvic part of the external obturator muscle. We also see this muscle right here traveling directly back along the rectum and is going to be attaching into the external anal sphincter. That's the levator ani muscle. And then if we look lateral to that, we see a separate muscle right here that's traveling more dorsally up towards the area of the tail. That's the coccygeus muscle. So the coccygeus muscle is lateral to the levator ani muscle.